I decided to become a doctor because my father is a doctor and my father is a gynecologist. And he showed me from a very early age, from a very young age, what it means to be a doctor. I recall that when I was only 4 or 5 years old, I would persistently ask him to take me to the OR to observe one of his surgeries. I asked many times until at one point he had no other choice but to accept my proposal, and that's why he took me to the operating room. And I recall that moment as something truly remarkable, that they had the capability to carry out surgical procedures on another individual who was completely unconscious. I also remember that as my adolescence progressed, I continued going to the operating room. So, at 18, when I had to choose my profession, I was certain I wanted to be a doctor and specialize in gynecology, just like my father. That's why I started medical school. Of course, it's a huge challenge in my life and for any doctor, but I pursued it with great sacrifice, tremendous effort, and above all, with great passion. I remember that when I was in my 4th year of medical school, we started going to hospitals to see patients, and I remember that on one of those first occasions, a professor, along with us, a group of 5 students, introduced us to the patient's bedside, explaining the clinical situation in which this patient with terminal cancer was. I stayed talking to this first patient and asked him if he knew why he was admitted to the hospital, and he said no, and that it had been a long time since any family member had come to visit him. This experience definitely had a profound influence on my professional career right from a very early age, which is why I had a strong desire to delve deep into understanding the emotions and true needs of cancer patients and their experiences. And that effectively marked my professional career definitively. That's when I realized that I not only wanted to be a gynecologist, but I wanted to treat women with gynecological cancer. That led me to subspecialize in gynecological cancer for another 4 years after becoming a gynecologist. These years I have the great fortune of working day by day treating women who have gynecological cancer. And in reality, they are the ones who teach me every day what the true important things in life are. Living day by day, not worrying so much about what happens in the future, giving true importance to family and friends. I believe that patients, of course, come seeking a person, a doctor, to cure their illness. But I think that patients who become ill with cancer also come seeking contact, attention, to be looked in the eyes when we speak to them. They come seeking a hug. In other words, the needs of these patients, as possibly of others, are much broader, beyond just looking for a doctor to exclusively cure their illness. I also remember, as if it were today, that day when I was in my 2nd year of medical school and my grandmother gave me an article that was published in a newspaper back then, which talked about what it meant to be a good doctor. I still keep that article in a very important place in my house, even though unfortunately my grandmother is no longer here, but from time to time I also read it, because that article precisely stated that a good doctor is not the one who is aware of the latest advances in medicine. A competent doctor is above all and primarily a good individual. And that is why I consistently strive to work towards that objective on a daily basis in this remarkable and fulfilling profession of medicine.